Hey guys. Yes, I'm so glad so many of you are still able to make it. I know it's the day before a holiday, but I do this on the first and third Wednesday of the month, so I figured I might as well try anyway. So welcome to Full Circle's Practice and Pregnancy Orientation. I am your host, Dr. Adams. Let me know if the sound is okay. It doesn't sound warbled or anything like that because we were having some technical difficulties with the sound before. If I can get a thumbs up, then I'll know that you can hear me and everything is good. All right, cool. Let's get started. We have a lot of stuff to go through today. All right, first, some housekeeping things. This is confidential. So when you ask me questions, no one will be able to see who's asking the question except for me. So please feel free to ask. There are no silly questions, and I will answer everything unless I think it is too personal, and people might be able to figure out who you are by that question. And so then I'll just say, we'll hold it for your visit. Please participate. I have some polls peppered and hidden throughout here to make sure that you're still paying attention and still awake. And then if you have to hop off at any point, no worries. I understand dinner time's coming up. You're preparing for your barbecues tomorrow. This presentation will be available on our YouTube channel throughout the duration of your pregnancy. So let's get started with a poll. This is how the polls are going to go. You will see a question pop up, such as, are you a first-time mama or are you a veteran mama? And when you answer the questions, it kind of helps me guide what comes next in the presentations. So please let me know so that I don't spend a lot of time on things that first-time mamas don't need to hear over and over, or veteran mommies don't need to hear. I'll talk a little bit. I'll say polls are closing in 3, 2, 1, and then that'll be the end of the poll. All right, and our mommy veterans way outnumber our first time mamas this time. I certainly hope my first time moms are going to watch this later on because this has all the questions that they were going to ask. All right, so things we're going to go over today. The full circle experience, which includes where we deliver, some of our office protocols, how to best get in touch with us, what to expect at each of your pregnancy visits. You're going to get lots of prenatal resources. We'll talk about exercise and nutrition in pregnancy and end with a quick COVID-19 update because that's still a thing. All right. So, first of all, our philosophy, we are a collaborative midwifery model practice, which is based on the premise that pregnancy and birth are normal life processes, not a disease that we have to cure you of. It's physiologic. It's what your body is supposed to be doing. And so, to that end, in the traditional midwifery model, they care for normal, low risk women, but if there is some issue, they may have to be transferred out for a different acuity of care. But in the collaborative model, if you develop some issue with the pregnancy, they still have physicians available on site. And you can still remain in their care for prenatal care and labor with physician direction for the complication part. We kind of split the physiologic and the pathology. To that end, the majority of our deliveries are attended by our certified nurse midwives. So I know some of you came in as our GYN patients, like, oh, I was your patient, Dr. Adams. Now you can deliver my baby. Maybe. Or Dr. Mara or Dr. Mooney. The midwives, we want you to get to know all of them because they do share call and they do the majority of the vaginal normal deliveries. If things fall outside of their scope, obviously they will contact one of us. If it is an urgent consult, they will give us a call. If it is an emergent consult, meaning they don't have the 15 minutes it takes for one of us to get in from home, there are OB hospitalists, board certified OBGYNs who are on staff and in-house 24 hours a day. And to put it in perspective, last year we did almost 550 deliveries and we only needed to use them 3 times. And those 3 times, the most common reason the hospitalists are called, honestly, is when people come in and they're 10 centimeters and they can't wait for any of us to get in and that baby is flying out. All right, so where do we deliver? We are now at HCA Florida Hospital, formerly known as Memorial. It's on University. It's less than 10 minutes from our office. They do tours. One-on-one tours are available. And they have quarterly stork tours. So when you come in and do your visits in the exam rooms, you'll see that the next tour, I believe, is August 22nd. And it's a really cute baby shower. They raffle off prizes. You can walk through the unit, meet the nurses, and see where you're going to meet your little one or little ones. But if those dates and times don't work for you, they will set up individual tours during the day, after hours, on weekends. They bend over backwards to accommodate you seeing the unit and feeling comfortable about where you're going to deliver. That is our only facility. The office is open on Monday through Thursday, we're open from 9 a.m. to 1 p.m. We close at lunch from 1 to 2. So if you call between 1 and 2, you will get the after hours line. And the reason we set it up like that is so that it still rolls to the emergency on-call provider if there's a medical emergency between 1 and 2. So please don't leave administrative voicemails on the phone, on the line between 1 and 2, because it goes to the midwife on call and she may not be able to relay it to the office staff in the meantime. Just give us a call back at 2 when we reopen. We reopen from 2 to 5 on Monday through Thursday. On Friday, though, we close at 1 p.m. And we are closed on holidays. So we will be closed tomorrow, but we will reopen on Friday from 9 to 1. My staff is super excited about that. 4 more hours in the work week. We don't have walk-in appointments. We try our hardest to see you at the time that we set your scheduled appointment. Our goal is to not waste your time. We tell you your appointment is at 9:20. We're expecting to see you at 9:20. So if someone else walks in at 9:15 and says they need to be seen, we're not going to give them your spot because we promised it to you. And so that goes both ways. We have a limited number of same day appointments. So if you are calling first thing in the morning and saying, hey, I think I need to be seen today, if there's a same day appointment, we will slide you right into that spot. If that appointment is way down in the day, like say 2:30, you're calling at 9 and we don't have an appointment until 2:30. If that's too far down in the day, we may say, hey, that sounds like a more urgent matter. You need to go to the hospital or be seen at an urgent care. It's not us saying that we don't want to see you. You're our patient. It's us saying we agree this is an urgent matter, but all of our designated slots today have been promised out to someone else, and we don't think you should just be sitting in our lobby waiting to get worked in if somebody doesn't show up. The next question that I have, we're going to hold off on just a moment because apparently there's a concert that someone wants to go to at 7 weeks. So we'll get to that in just a moment. It sounds like there's no mosh pit there though. Phone calls, when you do call with any concerns, providers are not able to leave appointments to take phone calls. You have to leave a message to get a phone call back. So we want you to know who you need to leave what type of message with so that you get your questions answered in a timely fashion. If you have questions about, like if this is a nurse visit, say you're concerned about baby's movements, you think you're contracting or that sort of thing, we have a nurse, Tony. Tony also takes care of FMLA and disability paperwork. So you'll leave a message with the nurse for clinical matters. Many of you have already interacted with Naisha, our OB clinical coordinator. She handles labs. So if you've already had your history visit with me and I've sent your labs out, they came from Naisha. At the end of pregnancy, she also handles scheduling things like your deliveries, and if you need any consultations with cardiology or the high-risk docs. And then everyone on here has probably met with Renee Hall, our benefits specialist, because she'll check your benefits. If anything changes with your insurance, like you think you've met your deductible, you've had ER visits or other family members have met the deductible, please let us know so we can update prepayment plans. It's not our goal to collect money that is not owed to us before you deliver. So just be sure that you're leaving the right message with the right person. After hours, there is always someone from our practice on call for our practice. So you just call the regular main phone number and follow the prompts to get to the emergency on-call provider. Like that service will be on all day tomorrow. And this is for if you think you need to be at the hospital, because remember, this is the person who is at the hospital delivering babies, taking care of emergencies, rounding on people, that sort of thing. And so if you think you need to join her there, then give a call to the emergency line. You have to leave a voicemail message in order to receive a call back. The phone does not register that a call came through unless you leave a voicemail. And then other ways to contact us, the patient portal. Please remember that the patient portal response times can take up to 2 business days. So this is not the place for emergencies. I think I need to come to the hospital because 2 days later, that's not how we handle emergencies. Um, Sorry, you all can probably see the next slide that's up there. It's lagging for me a little bit. If it's a non-action item, then we may delay answering it until your next appointment. Say if you have a lab from someplace else that we need to review, we may hold that over. So the portal is best used for things that can't wait until your next visit. So I lost my lab slip, but I really need to get these labs done before my next visit. We can definitely email you a new set. Have a dental appointment next week. Can I need a dental clearance letter? We can do that as well. If you have COVID and need to transfer your visit to telemedicine, that's also appropriate use of the portal. Please don't send urgent matters like my blood pressure's through the roof. I don't feel my baby move. I'm bleeding heavily. Those are urgent. Those are matters to give us a call on the after hours line so that you can talk to someone in a timely fashion about them. We also ask that you don't send blitz messages. So once you send one message to someone, remember that person has 2 business days to respond. So if you don't get a response, please don't the next hour send to someone else, the next hour send to someone else, the next hour send to someone else. Sometimes people get very upset. They go to their pharmacy and have 5 prescriptions waiting on them, and they don't know which one they should take, and they don't want to pay for all of these things. But if you send it to 5 people and we all start working on it, that may happen. The other thing that may happen is the computer may read it as it's a bot trying to spam us, sending multiple people the same messages and delete your account altogether. It's really hard to get that reinstated. Also, we ask that you don't try to have an appointment over the portal, like open-ended questions like, what are your thoughts about placenta previa? That's a visit. So remember the portal is after we've seen patients all day, completed our charting, reviewed all our labs and ultrasounds, and now we'd like to spend some time with our families. We're happy to do a couple of extra things if it will make it easier between this visit and the next. But if you're coming in to see us, then please hold on to the appointment questions until you have your next appointment. Or text yourself those questions so that you don't forget them, or schedule an appointment to come and see us. The other way that we use the patient portal is to release your ultrasound results. And I know at least one of you I've talked to recently. We need to find an ultrasound picture that needs to be uploaded. But ultrasounds, we release those to the portal within 2 business days, unless there is something urgently abnormal about your ultrasound. In that case, our sonographers know how to come and get us out of appointments. It's the only time that we'll interrupt appointments. And we will not let you leave the building until we discuss if there is something wrong with your ultrasound and make a plan for it. Otherwise, the reports have to download from the machine, upload into our electronic medical record system, be divided among the providers manually, and then we review them. So please give us 2 business days to receive your report, review it, and release it to the portal. And we usually do so with some commentary on it as well. If you know your anxiety will not allow you to wait 2 business days to know what's on that report, we ask that you make an appointment with one of the providers on the same day as your appointment. They can get a preliminary print off from the sonographer to go over any of the high points with you, and then you'll get the full report in a couple of days. Quest also has a portal. And sometimes they send the results to you first, and then it freaks you out because you see that the results have red on them. Please remember that red does not necessarily mean that it's abnormal. The reference ranges that they use for Quest are for non-pregnant individuals. In pregnancy, the reference ranges are different. So sometimes you'll get a message from me saying even the ones out of range are okay for pregnancy because there are some physiologic changes in pregnancy. So please give us time to receive the report from Quest, review it, and release it to the portal. Please don't screenshot your copy of what's from Quest up to the portal because it only makes us receive it and review it a couple of times, and it doesn't close our interface loop for the lab, which doesn't sound like a big deal to you, but when these tasks pile up in our inboxes, it is frustrating. So if you've been holding on to the report for over a week, though, and you haven't heard anything from us, then please let us know because we can reach out to Quest and get it so that we can close our interface loop and also let them know they're not sending us stuff because we should be receiving the reports that we ordered. All right. Any questions about any of that? And now I'm going to answer the concert question. So, yes, you can go to the concert. It really all just kind of depends on how close you're going to be sitting. There's a certain decibel level that we prefer that you don't go over in pregnancy. At 7 weeks, though, you're not going to affect the baby's hearing yet. So, yes, enjoy your concert. All right. Next, prenatal visits. What to expect at each visit. First thing to expect is that you are going to forget all of your questions that you had leading up to that visit. Something about hearing the baby's heartbeat makes you forget everything you are going to say. So please start a text thread with yourself so that you have your questions ready and available when you come in for your visits. We ask that you wear loose, comfortable clothing so that we can access your belly because at every visit, we are going to listen to the baby's heartbeat, not an ultrasound, but we're going to use our Doppler to listen to the baby's heartbeat each time we see you. We want you to get here a minimum of 5 minutes prior to your scheduled appointment so you'll have time to check in and complete any business with the front desk. ACOG is no longer requiring the American College of Obstetricians and Gynecologists, is ACOG, no longer requiring or recommending checking urine samples routinely. So you only need to leave your urine if it's indicated. If we're following you for blood sugars and looking for glucose in your urine, or for blood pressures and looking for protein in your urine, or if you've recently completed a treatment for bacteria in your urine. So you'll know if you need to leave a urine sample. Otherwise, we know you're pregnant, you've been drinking all day, the baby's sitting on your bladder. When you come in, go on to the bathroom. It's okay. 9 times out of 10, if we need a sample, we can still get another one out of you 10 minutes later because, again, the baby's kicking your bladder. If you're 10 minutes late for your visit, we'll still have time to check on you and the baby. It obviously leaves a lot less time for questions. If you're 20 minutes late, you've missed the entire appointment slot, and we'll try our hardest to work you in later in the day. Front desk is really great about seeing, oh, she's not going to make it to this 2:20, but I see Jane has a 2:40 over here. Let me just slide her over here onto that schedule. If that time doesn't work for you, though, just let us know. We're happy to reschedule to a time that works best for all parties involved. Sometimes traffic is the issue, and everybody's late. Like today, something was going on the bridge, and like three of my patients were 15 minutes late in a row. Um, and so we give grace. We're not barbarians, but our goal is to make sure that we are still being respectful to the person behind you who is able to get into her appointment on time. All right. Diagnostic ultrasound visits. So the next question I get is, when am I going to have another ultrasound, Dr. A? Good question. Diagnostic ultrasound appointments are separate from the regular prenatal visits I'm going to go over soon. The way to know if you have an ultrasound scheduled is to look on your portal and see, do you have more than one appointment time? And is there a provider's name associated with your visit? So when Tina Test, my imaginary patient, goes online, she goes into her portal and she clicks on the appointment button. There, Tina sees that she has two appointments scheduled, one at 9:20 with ultrasound, which is not a provider's name, and then one at 10 o'clock with Dr. Yeckel, which is a provider's name. So Tina knows she has an ultrasound schedule, so she can tell her family, hey, you guys want to see the baby? Come with me for this 9:20 appointment. And then she can go over a preliminary report with Dr. Yeckel afterward. And remember, if she doesn't have that appointment afterward, her results will be sent to the portal in 2 business days unless there is something urgently abnormal. And in that case, those findings will be discussed on the same day. We'll pull one of us out of the room to come and talk to you. So as you're checking out from your visit, if your provider said, hey, you need an ultrasound next time, please let the front desk know when you need both. We're sending messages to the front desk saying, hey, we want her to schedule both, but sometimes computers are slow and you get to the front desk before our message goes through. So if you've heard you're supposed to be scheduling one, be sure you get 2 appointments scheduled, not just the ultrasound, but also your prenatal visit, even if they're not on the same day. Now, if you want to look at your baby more than we say is medically necessary, boutique ultrasounds are a thing. They are not dangerous at all. In fact, they're super fun. I did them with all my babies. Stork's View, Baby's Close-Up, Sneak Peek, these are for informational purposes. I know there are a couple of more out there. I'm not endorsing any specific one over another. I just tried to find a couple in different areas of town. But they do really cute things like sneak peek reveals at 14 or 15 weeks to see if it's a boy or girl. They do like putting the heartbeat in a teddy bear and you can have your family in there and all that stuff. It's very adorable. So we will typically look at baby around 20 weeks for your anatomy ultrasound, and then if you go past your due date. But anything other than that, when there's not a medical diagnosis for it, check out one of these boutique ultrasound places. So the next question I have is, what is the general frequency of, so hi, I'm asking you the question before you ask me. The question is, what is the general frequency for ultrasound and when do we find out the gender/anatomy scan? So I'm going to flip the question. When should I expect routine ultrasounds? Feel free to vote now because the polls will be closing in 3, 2, 1. There. All right. So ultrasounds are, as I just mentioned, at 20 weeks is when you have your routine anatomy ultrasound. Now, this ultrasound is designed for us to take a look at the brain structures, the heart structures, the spine, the kidneys, the length of the long bones, and all of that stuff. If baby is cooperative, we're usually able to see if it's a boy or a girl. But if baby is not cooperative, then you may want to check out one of these boutique places to tell you about that. But we are not doing ultrasounds at every single visit. Now, routine ultrasounds, around 20 weeks for anatomy. And then if you go past your due date, just to make sure your fluid and baby's movements are still good. Things that are not routine, if we don't see everything we need to see on the 20-week ultrasound, you may have more additional ultrasounds scheduled, but that's not routine. So I answered your question just as you were answering mine. All right. And next question is, if I do the blood gender test, do we still get to do an ultrasound too? Yes, because remember, the ultrasound is not to find out if it's a boy or girl. The ultrasound is to make sure that the brain is okay and the heart is okay and the kidneys and all that other good stuff. So yes, the blood test about chromosomes is optional because I don't use that information. That's something that parents want to know, plus or minus. But the ultrasound is something that I absolutely do use because I need to know that it's safe for you to deliver with a level 2 NICU, which is where our hospital is. All right, now we're on the website. This is fullcirclejacks.com. And you'll see, for those of you who delivered with us before, we were at Ascension probably when you delivered, and we have moved to HCA, as I mentioned. And if you missed the town hall we had back in October, it was a glorious time. You can click on that blue button up there at the top, and it will link you to the YouTube recording of our town hall about why we moved. And I'll tell you, it's been going really, really well. We're moving up on a year, about 400 babies now at the HCA facility, and lots of smiles. So we're going to see first who the providers are. One of these fortunate, lovely ladies will have the pleasure of attending the delivery of your baby or babies. So there's me up there at the top. There's my buddy, Dr. Marrow. There is my friend, Dr. Yeckel, and my other friend, Dr. Mooney. And then we have the midwives. There's midwife Lauren, midwife Krista, midwife Cindy, midwife Dawn, midwife Missy, and midwife Jane. And every single one of us is doing what we love doing the most, helping people grow their families. All right, so some good resources over here. You will see under patient information, you're going to go to the obstetrics tab and you'll know you're in the right spot because you will see the babies and the belly there at the end. So our delivery stats are out here. We're very proud of our statistics. Some years are better than others, but you can see them all the way back to 2018. The labor to cesarean rates are pretty steady across the board there, and that's why a lot of you are here. The prenatal care timeline, we will click on and take a look. So this is what to expect at each of your prenatal visits. So everyone on this call has already had their confirmation ultrasound. We like to do those between 8 and 10 weeks. And then typically within 2 weeks of that, you have a virtual visit with me, which is your OB history, where I go through your medical history and if applicable, your pregnancy history. Once I figure out what you have in your history, we figure out what blood work we need for a baseline and we get that ordered. Everyone does the standard obstetric labs. So those are here in the middle. We do have lab transparency. So there are times people transfer in and they say, I really don't know what blood they drew. That should never be an issue here. There's no sneaky lab draws. So everything that you're expecting to have drawn is out here in the open. And these are the ones recommended by ACOG. And it includes your blood type, your blood count, some serologies, and a urine culture. You'll see in that next box there the optional genetic screening. And so those include the NIPT or the nuchal translucency ultrasound. At that same confirmation visit, you all had an opportunity to talk with Renee Hall about your benefits as well, and your homework is to finish those labs as soon as you can. At this point in pregnancy, we're seeing you every 4 weeks in the office. So when you called in with your positive test, they scheduled 3 visits, and you said, "Whoa, calm down." But the third visit that they scheduled is your physical exam. So it should be approximately 4 weeks after your confirmation visit, just getting you back in the office for your physical. And the physical is just like it sounds. It's a regular physical, heart, lungs, breast exam, pelvic exam. Um, Cervical cultures are part of the prenatal panel, but a pap test is not. If you would like to have a pap test done just because you're due for one, you haven't had one in several years, we're happy to collect it at the same time, but it is not obligatory. About 4 weeks later, then you're back in the office for a belly check, second trimester. So some of that nausea and fatigue should be gone by then. And then we see you 4 weeks later for your anatomy ultrasound. Now, you'll also see there in the middle mental health screen too. So that is something routine that we do around the anatomy ultrasound. We screen everyone with with the Edinburgh Depression Scale and the Global Anxiety Scale. And that's, again, if you get the survey, it's not because we saw something and we're singling you out, but we're a holistic practice, which means we take care of the whole person, which includes your psychiatric and mental well-being. Pregnancy is full of emotional twists and turns and ups and downs, so we want to make sure we're staying ahead of things. So the anatomy ultrasound, as we discussed, between 20 and 22 weeks. And if you meet with a midwife around that time, she will be talking about childbirth education classes and breastfeeding classes to get signed up before the baby gets here. Then about 4 weeks later is where we would request the glucose test. And I know I have questions about that, so just hang on. I'm going to put a pin in that, but we will get back to it. My moms who are Rh negative, we have a couple of different options for you. And if you are found to be Rh negative, I do send you a message with the 3 options for how we deal with Rh negative moms and that blood type. Around this time is when you want to complete your hospital registration, take a tour of the hospital. You plan to work with a doula, which we'll talk about in a moment as well. You want to get that locked down as well. So then we start going to see you every 2 weeks. So it starts to ramp up. The Tdap vaccine, the flu vaccine, if you're during those particular months, the RSV is there now as well. We do not give those in the office, but if you would like to get them, we refer you back to a Minute Clinic or to your primary care doc. You also see there in the middle the option to repeat some of the standard prenatal labs. This is more of a Duval County Health Department thing if you feel you're in a high-risk population for contracting certain illnesses, certain bloodborne illnesses during pregnancy, then you can definitely repeat it. Healthcare workers could be included in this group as well. And then we continue with the every 2 weeks until 36 weeks. When we do another pelvic exam to screen for group beta strep, we'll explain what that is and why it's important at that time. And if you've opted out of repeating STD screening in the third trimester, then that can also extend to repeating your cervical cultures. Then we start seeing you every week. Now, prior to that, my moms who are expecting to have a belly birth, which is our term for the cesarean delivery, typically we'll try to figure out what your date is going to be by the time you're about 33 weeks. So you can start planning for that, get family in town and all that good stuff. My moms who have other pregnancy complications like high blood pressure or diabetes, we begin additional testing prior to this point. And then around 39 weeks-ish, unless you have some other condition that makes it sooner, is when we plan our scheduled belly birth. For those who are waiting for labor, for baby to give that signal, then we wait. We would like all babies out by 42 weeks. And so for first-time moms, we usually like to plan induction at 41 weeks and 5 days. For our veteran moms, 41 weeks and 6 days, because your labor is usually a lot shorter. The things we don't usually go over is that for first-time moms, the average length of labor is about 24 hours, and that's if you go in spontaneously. So an induction can take longer. And second-time moms, it's usually about half that length. Question here. Do patients wishing to attempt VBAC have to schedule a C-section? No. If you're going to, no, I mean, if you have not had a vaginal delivery before 41 weeks and 5 days, but we will induce, it's considered a medical induction at that point. We don't do elective inductions. And the next question I have is, what if I can't have the glucose test since I'm dye-free? I have a solution for you. You hang on to that question. I'm going to answer it a little later on, I promise. All right, we're going back to the presentation now. And many of you that I talked to have had headaches and constipation and nausea and a bunch of other unsexy pregnancy things. So here's my poll question. If you have a headache, are you more likely to meditate, or medicate, take a Tylenol, or evacuate, get out of the house and go to the emergency room? So usually I'm more of a Tylenol girl, I'll just be honest with you. I say it depends on the day, but the day is usually ending in Tylenol. And the polls are closed. All right, we have more medicators than meditators. I wonder if that has to do with more veteran moms than first-time moms. But for those who have just been suffering with it, I'm sorry, you don't have to do that. Here is our list of safe medications in pregnancy, also some relief measures that you can take before you move to medications. So you can see the common discomforts and symptoms over here. On the left side, I have them alphabetized. And then in the middle, these are the relief measures to try first. And if you've exhausted everything on there, head on out to Walgreens or CVS. Or Publix and get some medication. Not everything on here is Western medicine. You'll see some things are more holistic, like super aloe tablets, vitamin B complex, peppermint oil, rosemary, just to name a few, papaya enzymes. But then there are some things that are also that are Western medicine and non-prescription. You'll see some caveats on here too. Definitely call us if you're unable to keep down fluids or for 24 hours. Please don't continue trying ginger because we need to give you a prescription because you'll become dehydrated, which is dangerous to baby. But just remember, all this information is out there. If you send us a portal saying, oh my gosh, I'm so constipated and I don't know what to do, the first thing I'm going to send you is, have you tried everything on this list? And I'm going to send you a link to this. So you guys have gotten smart now. All right, Dr. Adams, I've tried everything on the list. So what else do you have for me for this problem? But definitely be sure you visit this first before reaching out to any of us, because all of us know this is out there and we all want to make sure that you try these things first, because this is our first advice. All right. The diabetes screening test. You just asked me a question about it, and I am putting a pin in it. I did not forget your question. We will come back to it. Remember, this button is out here. We're going to click on that later on. Weight gain in pregnancy. Many of you have been very concerned that you're not gaining weight in your first trimester. Don't freak out. This is the recommended amount of pregnancy weight gain based on what your starting pregnancy weight was. So there's a link here that you can click on and put in your height and pre-pregnancy weight. That gives you your pre-pregnancy body mass index. And based on that, you can see what the recommended weight gain is in pregnancy. If you have twins, you can add 10 pounds to that top number there. But you can see in that last column that the rates of weight gain are in your second and third trimester per week. So if you don't gain in your first trimester, don't sweat it. Your baby is taking the best of what you have going on right now. So actually, you may lose a little bit, but baby is still gaining and getting bigger. And so by the time things even out with the pregnancy hormones and the nausea in your second and third trimester, that's when you'll start to gain the significant amount of weight for your pregnancy. And the food aversions and all that stuff will go away and you'll feel a lot better. We're going to click on the birth preferences next because there are also questions about birth plans and what things you can and can't do and all that other stuff. So this is our template for a birth plan because first-time mamas, this can be anxiety inducing that you've never done this before and you don't know what to expect. So sometimes writing some things down, things that are important to you, can take some of that stress off, just having a good, clear plan for communication ahead of time. And you can see there's a lot of things on there, everything from how you want labor to start to what you want to wear during labor, how you want to manage discomforts of labor. But one thing I do want to highlight, we are not starving you and strapping you down to the bed. So you'll see things like how you want to labor. You can walk around, you can sit, lie down, rock, stand, hands and knees. We really don't care about that. As long as we can make sure that your baby is okay. Positions do not matter. You can push in any position, you can deliver in any position. Our standard is still delayed cord clamping, immediate skin to skin. If you're planning cord blood banking, just let us know because we'll measure out how much to delay cord clamping so you can still get a good specimen, deciding what to do with your placenta. So you can just see, like, it may look overwhelming because there's so many things on here, but everybody on here, I believe, has at least 20 weeks of pregnancy, and every box on here doesn't apply to you. So just know that you can take one box per week and just break it down a little bit. And everything on here is a matter of personal opinion. So there's nothing on here that is harmful or dangerous. And so please take the opportunities to bring this in and talk to the midwives at your visits. What is this about? What's the advantage of this? What does this even mean? And does this apply to me? Because that's what we do at the visits. We want to talk about this stuff with you. Cervical ripening techniques, because at the end of pregnancy, the only question y'all ever have is, how do I end this? So these are things that you can start doing to get your body in shape for labor, so to speak. So toning the uterus from 20 weeks with raspberry leaf tea, to having a good acupuncturist, to taking evening primrose and eating dates and using clary sage oil. All of these things are out here. What is not on my list is castor oil, and you can ask the midwives why that's not on my list. All right, but just remember that this is out here at the end of pregnancy because we will be talking up to you about these after you have your group beta strep collection. All right, and then first time moms and trial of labor moms. So do I have, so I believe from the question I have at least one person on here who's had a prior cesarean and is looking forward to a VBAC. So first time mamas, this will not apply to you, but if there's anyone who's doing a labor after cesarean, there's only two options. It doesn't apply to you, or yes, and you're gonna rock it. And the polls are closed in 3, 2, 1. Boom. All right. So first time mamas and moms who had a VBAC, who had a cesarean before, you guys have the same goal. You are trying to avoid the cesarean that you can avoid. So you can't control what the baby's going to do. Babies are going to baby even after they're out. But control what you can. There are things that you can do to reduce conversion to cesarean. So many of you know I'm a VBAC mom. Dr. Marrow is a VBAC mom. Lauren is a VBAC mom. So we are a practice that is not just VBAC tolerant, we're VBAC supportive. We're excited about you wanting to try, and we're in it as much as you are. And so these are things that all of us did when we were looking to avoid our next cesarean delivery. So you can just read through here, daily squats, watching your weight gain, having a good doula, starting your acupuncture, avoiding non-medical induction. This is for my first time moms. Y'all get so tired at 38 weeks and you just say, I don't care, just get the baby out. And then the next time when you're trying to go for your VBAC, you say, man, I just wish I could have been patient and waited. So the last is the most important. Trust your body and your providers. Our stats are our stats because that's what we want our stats to be. We are not trying to rush people to cesarean. So if we're recommending something, it's so that you can avoid an unnecessary cesarean. So please trust us. That's why you came here. All right, so remember that this is out here as well. And if you are having a boy and you want to have him circumcised, we don't do those in the hospital. Those are done in the office before he's 10 days old. And the way it works is when you deliver, we will ask again, hey, are you planning to have little guy circumcised? And if the answer is yes, then look out for a phone call from our OB coordinator, Naisha. She will get him a little appointment with either myself, Dr. Miro, Dr. Mooney, and we will take care of him. All right, and question here is, what about walking? I think you should. I'm not sure in which instance, but definitely walk. Walking is good for you. Go for it. All right, we're moving into nutrition, and I immediately feel attacked because I start to complain about, oh man, I don't know why I'm gaining weight. I only had coffee this morning. Or did I have this salted caramel mocha monstrosity, 570 calories? Holy cow. Did you know pregnancy only requires an additional 300 calories per day? And 10 kilocalories is what it takes to maintain a pound of body weight. And recall that the goal amount of weight that you gain is based on your starting body mass index. So if you're starting the pregnancy at 170 pounds, it takes 1,700 calories to maintain that. If your goal is to gain 25 pounds, that's 250 additional calories for a total net caloric intake of 1950. You split that between your meals, that's 650 per meal. This is assuming you burn 0 calories during the day. Obviously, if you burn some calories, you can have a few more calories taken in, but your net caloric intake should be about 650 per day. And don't drink your calories. Once you eat that 650, please don't wash it down with a 570 calorie mocha monstrosity. So, what should we be eating? These labels just show how easy it is to make simple changes that are very impactful. So, when you're cutting back on your sodium, just taking a look and seeing that just making a change from traditional spaghetti sauce to 20-minute herb infused marinara can cut down 500 milligrams of sodium to limiting the fat that's in your foods, making sure that your protein is at a certain point, which we're going to talk about in just a moment, and the carbohydrates. Oh, the carbohydrates. All right. So things that you should be eating: your fruits, your veggies, your whole grain cereal. If you're allergic to nuts, don't eat nuts. But you're not going to make your baby allergic to nuts or dairy if you eat those things. So please enjoy. For my coffee drinkers, you want to keep your caffeine at less than 200 milligrams daily because caffeine is a diuretic and a cardiac stimulant. So since it is both of those things, if you can, if you can have less, then definitely have less. If you're going to drink coffee, please use the 3-to-1 rule. Drink 3 times as much water as caffeinated beverage. And toward the end of pregnancy, if we do hear irregular heartbeats with the baby, that may be one of the first things that we say to cut out. And so herbal teas are great. These are some of our favorites for pregnancy: raspberry leaf, ginger, lemon, and peppermint. And for protein, we were just discussing how much is the right amount. Some of these pregnancy diets will tell you to cram in 100, 120 grams of protein a day. Please do not do that because you will grow an 11-pound baby. 70 grams of protein is an appropriate amount. If you take in too little, you have these scrawny little underweight babies, but 70 grams is a good place to be to grow a normal size human. You can have deli meat. Just be sure you're microwaving it for at least 30 seconds to kill any harmful bacteria. If your soft cheeses are made with pasteurized milk, they're fine. If you cannot tell, then please do not eat your soft cheese. You can have 3 of those 4-ounce cans of tuna per week. If you are a pescatarian and you need to know more about fish, the FDA has a really nice document out there that tells you which fish you should be eating sparingly because of methyl mercury, which fish you want to eat a lot of because it has high DHA in it, and which fish you should eat in moderation. It's a 2-page document. You can see the link right here. It's on our YouTube channel. But just remember that this will be out here for you to take a look at. I didn't put the whole thing out there, but if you need to eat more fish, this is a good document to tell you about the fish. Things you want to stay away from. Undercooked meats and undercooked fish. For my kombucha drinkers and my kimchi eaters, those are fermented foods. If you've had a little bit already, you're probably just fine. But just you don't want to continue to have those. Same as alcohol, and alcohol for the fermentation as well. We don't know what the amount is that causes fetal alcohol syndrome, and so we can't safely recommend any amount. And then limiting your sodium to 1,500 milligrams per day. Once you start looking at how much sodium is in the things that we eat, you will be appalled that 1,500 is supposed to be your daily limit. So I'm going to tell you, when y'all send me a message and say, Dr. Adams, my rings don't fit anymore, the first thing I'm going to say is, what did you eat last night? Chinese food. And I know there's a lot of sodium, all the soy sauce, I'm pretty sure. All right. Any questions on food before we go to exercise? All right. So from my friend who asked me, what about walking? All right. It is fine to continue your pre-pregnancy activity unless your pre-pregnancy activity was doing nothing. In that case, you need to start doing something. But I know nobody feels like it in their first trimester. Everybody's sick, everybody's tired. But in second trimester, you increase your blood volume by 50%, your oxygen tensions and saturations go up, and you are more able to accommodate the aerobic activity. And so if you were an Olympian before, don't worry, you will return to your former glory. worry. Just listen to your body and you will get back on track. Now, if you weren't doing anything before, it is okay for you to start a new regimen. It doesn't have to be anything crazy. You can just start doing some squats, which I'll go over in just a moment. I think you guys can see that next slide. Hold on. Just remember that a sedentary lifestyle leads to malposition babies. The most common reason we do review all of our C-sections, our first-time mama C-sections, and try to figure out if there was anything we could have done differently to avoid the C-section. When I tell you we're serious about this, we actually are. So each and every one of them. When we go through, the most common reason for our first-time mamas getting C-sections is malposition babies. Sunny side up, their faces are up, their heads are down, but the face is up, or the head is crooked in there. Those of you who are working from home and sitting in front of computers at the desk all day, kind of slunched back like this, need you to get one of those balls to sit on so that you can arch your back more and encourage that baby to descend and rotate. Those of you with these cute little Fitbit watches that are causing you more anxiety because you're watching your heart rate all the time, your resting heart rate will normally rise 10 to 20 beats per minute. That is normal. If, however, it's making you dizzy, you're losing conscious, blacking out, that is not normal. But if you just see an elevated heart rate, that is what your body is physiologically supposed to be doing during pregnancy. And so some of you are saying, oh, I am doing a great exercise. I'm walking. What about walking? Walking can be considered exercise if you're walking with your heart rate in the aerobic zone, which is 70% of your max heart rate. Your max heart rate is 220 minus your age. So when you get old like me, you're not supposed to have your heart rate up really high. So we start at 220 and you are 30 years old, you should not be exercising with your heart rate sustained above 190 for extended periods of time. But 70% of 190 is 133. So in order to say that you're exercising, your heart rate needs to be at least 133. So if when you are walking, your heart rate is between 133 and 190 for 30 minutes, 3 times a week, then exercise, your walking is exercise. If your heart rate is still somewhere between 80 and 110, then your walking is transportation. And I'm glad you're getting where you're going, but you are not exercising. So the question I have here, and let's see, can pre-diabetic women have vaginal deliveries? Absolutely. I mean, there's no other reason that they can't. Pre-diabetes is pre-pregnancy. Wait, I'm not sure if you're asking pre-pregnancy diabetic or you're almost diabetic. The answer for both of them is fine. Yes. In fact, it is preferred. If you have anything that's diabetic, you have a lot of issues with healing, and we prefer not to cut you. The next question I have, I'm in the military, did a lot of rucking pre-pregnancy. Is that the weight, Gary? The weight carrying? If that's the weight carrying, you're conditioned to, you can lift whatever you were lifting before, and I'm going to tell you about that in just a moment. And the next question I have is, when is it unsafe to lay on your back during labor? So we'll talk about that in a moment as well. All right, y'all have good questions. This is excellent, but I already had answers to all of them. So cardio is fine. If you love the treadmill, go for it. You like your elliptical, have at it. Running, yes. Swimming, absolutely. I love swimming. You guys are so lucky to be pregnant now because swimming is my favorite. It makes your belly weightless and your joints so loose, and it just feels good. It's an all-over workout. Indoor biking, if you have a Peloton, my leaderboard name is Off My Meds 8. Please feel free to follow. I do follow back, and we can exercise. And you can keep me honest about how much exercise I say I'm doing. Weightlifting, the question. Whatever you were lifting pre-pregnancy, however you were lifting it is fine. Do not increase your resistance during pregnancy, as your baby and your body will be doing that. But whatever you were conditioned to lift before, carry on. Squats, please build up to 50 squats per day. So if you are an experienced squatter, whatever you were squatting before, go for it. If you have not been squatting, please start with at 20 weeks, give me 5 squats a day. 21 weeks, give me 10 squats a day. 22 weeks, give me 15. You're going up to 50 a day, and they don't have to be at the same time. You can give them to me throughout the day. You can do 25 in the morning, 25 at night. Pilates and yoga are some of my favorite pregnancy exercises because anything that opens the hips, opens the pelvis, makes those muscles long and lean, that is what we want for delivery. And any experienced instructor will be able to show you what the pregnancy modifications are for those. So things you want to avoid, high intensity interval training after your first trimester. So it's not the interval, it's the intensity. You can do the low impact versions of these things, but those sudden jerking movements, we don't want to shear the placenta off of the uterus with those sorts of movements. Anything that has you lying flat on your back for extended periods of time, and this is specifically for exercise because you are taxing your aerobic system during that. Like excessive ab work. You can do side lying abs, you can do standing abs, but just not ab work on your back. Hot yoga, unless you are a hot yoga instructor and are fully acclimated to that environment, then we ask that you don't do hot yoga because you'll get dizzy and pass out in there. Scuba, because of the decrease in barometric pressure. That decreases oxygen to the baby. Same thing with high altitude hiking. You're fine between around 8,000 feet above sea level is fine. Higher than that, though, you can visit family if you need to there, just don't go hiking with them. Contact sports, please do not take up kickboxing during this time. I had a lot of questions about pickleball recently, and the people have just been getting, I don't know, they've been getting hit with paddles and all sorts of ways that pickleball is usually not dangerous. If you can find something safer to do, please do that. And then outdoor biking after 16 weeks is not a no, but just a precaution because 16 weeks is where your center of gravity changes, and you may find yourself not able to round the corners and stay up. You may kind of tip over a little bit. So now that we have gone through everything about diet and exercise, I have another question. Um, to the question that I was not expecting to ask you was, oh, there it is. All right. Can you prevent gestational diabetes with diet and exercise? Um, and my veteran mamas know, can you prevent is the question. What? Not one person? Really? Oh my gosh. Okay. Yes. Okay. Thank you. No, the answer is no. You can't prevent it with diet and exercise. You can manage it with diet and exercise, but you cannot keep yourself from becoming a gestational diabetic just by your diet and exercise. Let me tell you why. This is why we screen everyone for gestational diabetes because your number one risk factor is your placenta. You know how hormones are the cause of like everything when you are and are not pregnant? Gestational diabetes too. So the placenta gives off hormones that tell your insulin that it doesn't have to do its job. The job of insulin is to clear your bloodstream of glucose so you can use it as energy. So if your placenta is telling your insulin, just leave the glucose out there, you have excess glucose in your bloodstream. That is gestational diabetes. Gestational because it's caused by your placenta. Like you wouldn't have it if you didn't have a placenta. So if you don't have a placenta, then I will not test you for gestational diabetes. But if you do have a placenta, and I'm pretty sure every mama on this call does, then I need to test you for gestational diabetes. All right. So some of you say, but Dr. Adams, I never eat or drink anything with sugar in it. You have good carbs, you have your fruits, you have your whole grains. Please don't avoid those things prior to the test because then your body will not be used to processing carbohydrates. And we don't want to get a false positive on the test. Now, if the actual drink is what gives you trouble, and this is going back to answer that question I had before, then we have alternatives for the drinks. Here at the office, we have Simply Pure, which is available for purchase. It is soy-free, it is dye-free. See, it is gluten-free, it is BVO-free, it is kosher, it is vegan, it is offensive to almost no one. Other patient-driven options are on our website. So remember that one box that we didn't click on the website? It has glucorganics, it has fresh tests, and it has glucose tablets in the amounts that you and the links for you to purchase them. So there are many different ways other than the very offensive drink that's at Quest or LabCorp. If you're planning to do one of these alternative methods, please let your provider know when she orders it because Quest doesn't take outside drinks. We have to send you to LabCorp and we need to put on there that you are bringing an outside drink. And if you're using the tablets, we have to put how many you're going to take. Don't open the drink before you go in there. All the instructions are on the website for how to do outside drinks at some of these commercial labs. And the next question is, what happens if you test positive for it? What happens next? Then you get to join Dr. Marrow's Sugar Mamas Club. So fun. She'll go through all the instructions with you if that happens. Don't worry, we're going to take excellent care of you. All right, preparing for birth. So these are some, and some of you are looking to do unmedicated deliveries, and we recommend method classes for that. So things like hypnobirthing, hypnobabies, Lamaze, and Bradley method. So these are again for informational purposes only. No one specific method or provider over another one, and you can find other people who are offering these same things as well. These are just some people that we've worked with for a while. Next. Also, breastfeeding classes, La Leche League does have breastfeeding classes as well. And our hospital has a lactation consultant too. If you're having any trouble after you deliver, you can make appointments and go back to the hospital and meet with Sonia again. She's super sweet and very knowledgeable, and your insurance covers it. CPR for parents. Every new parent should know CPR. And if you're like, "Oh, I already know adult CPR, I'll just do it with 2 fingers." It's not the same thing. It's different ratios, and you should take a refresher just so that you are safe and ready for your new little baby. We encourage chiropractic care. First time mamas, VBAC mamas, please pay attention. Webster certified chiropractors. Get these babies straight, please. Get your hips straight so that these babies are not in there with these little crooked, sunny side up heads, please and thank you. When you come out of our bathrooms in the front, you'll see business cards up at the front for people we know throughout the city who are Webster certified. All right, I believe now we have a poll about doulas. How many of you all are planning to work with a doula? That's what the poll is going to say. It may already say it for you because, again, remember, I'm over here with a weird lag. All right, so who's going to work with a doula? Now, for the first time mamas, I certainly hope y'all are clicking yes. For my VBAC mama, I hope you're clicking yes as well. Polls are closed in 3, 2, 1. Done. All right, so some people are not sure because they don't know what a doula is. All right. Next slide. So doulas are there for labor, for emotional support, emotional and physical support before, during, and after pregnancy. So they are there to help you remember your breathing techniques. They're there to help you get into different positions to increase your comfort and relaxation during labor. They're there to continue to advocate for you and remind you about your birth plan. Doulas bring us a lot of patients because they know that they don't have to spend their time arguing with us about trying to fight for what their client wants. They can spend their time advocating or supporting their client better, actually. The doula is not there to give you medical advice. Like, they don't want to be the person who's telling you that you should refuse this or take this medicine or not. They are there to be a physical and emotional support. They're not giving you medical care. They're not prescribing anything, and they're not delivering your baby. So please get to the hospital on time because your doula does not want to deliver your baby. She literally brought you to us so that we could do it. And postpartum doulas are a thing too. We're going to talk about that in a moment too. The best doulas with whom we've worked are the ones who will either, like when your labor starts, they come to your house, they are with you all throughout labor, and they do not leave your side until that baby is latched. They may come with you to some prenatal visits. They may help you make your birth plan, that sort of thing. So if you plan to work with one, definitely ask the midwives who their recommendations are for doulas, because they have no shortage of opinions on who they love to work with. Acupuncture and pregnancy massage, we discussed a little earlier as well. Again, the business cards at the front of the office, there are people who specialize in doing these things. For massages, we do have a letter. So if you're planning to get a massage, some places won't do it during your first trimester, and we can give them a letter saying that it's safe in your second and or third trimester. Many of your insurances cover breast pumps. Please do not go look for your own place to get a breast pump. We've got it covered for you. It's in the exam room. Scan our QR code around your anatomy ultrasound is a good time to do it. And it automatically gets in touch with the company that will reach out to your insurance company, find out what's covered, send you your choices, write the prescription, and send it back for us. It's super easy for us rather than going back and forth with some of these other places that try to do it. We've gone through many companies, and this one is really easy. Also, preparing for for birth and preparing for pregnancy, maternity, or paternity leave. We're using a third-party vendor now to decrease the amount of turnaround time for your FMLA paperwork. And most of the forms, you're getting them back in about 24 to 48 hours. Those of you who have ever submitted forms with us before know it used to be a 2 to 3 week process. So when you come in and you're asking for your maternity forms, not disability, but specifically FMLA, then we will be referring you to use Leave Guru as that third party vendor to increase patient satisfaction and decrease office frustration as well. Postpartum care. For my moms who have any issues with their blood pressures, we'll be seeing you back in the office within about a week to make sure that you're not developing postpartum preeclampsia, because that is a thing. Preeclampsia doesn't mean prenatal. The first 14 days after delivery for those who are at risk are the riskiest. If you had a belly birth, we'll see you back around the 2 week mark for an incision check. We do routine mental health screens for those who we've identified as being at high risk. If you had a baseline of anxiety or depression, or you had it in a previous pregnancy. And this is where postpartum doulas come in too. A lot of them help us to bridge that gap to keep that communication open if you need to see us sooner. The Motherhood Space is an amazing resource here in Jacksonville. It is grant run at the Winston YMCA downtown. It's kind of like daycare for moms with psychologists and yoga teachers and painting instructors and walking along the river. And if we find that you are a candidate that you're at risk for postpartum depression or anxiety, we will happily refer you to the Motherhood Space, which is covered by your insurance and has all-day daycare for babies from 6 weeks to 12 years old. And pelvic floor therapy, which is standard of care in many European countries. We offer here in our office, also covered by your insurance. And so right after you deliver is the best time to do it. You've met your deductible. 8 visits with Cynthia, our pelvic floor therapy nurse, comes in here 3 days a week, and she will help you get it back as close to how it was when we found it, because babies do change things. All right, random frequently asked questions. You can sleep on your left side, you can sleep on your right side, and you can sleep on your back. This was a question that I had earlier. For some people, though, the weight of the uterus and the tilt of the uterus may cause them to be uncomfortable when they wake up, like dizzy. If that happens, you can get one of the wedge pillows from Amazon and just slide it under one of your hips, and that way you can't roll completely onto your back. But when we don't want you on your back is flat on your back is when you're laboring, because as your contractions decrease baby's oxygen every couple of seconds, or every couple of minutes, really, we don't want you on your back. You can help paint the nursery. Just be sure you're in a well-ventilated area and wearing your mask. You can take probiotics in pregnancy. You can also dye your hair, including your eyebrows. You can do gel nails. You can get gel nails. Just if you're sitting in a salon with a lot of fumes, you may want to wear your mask during that time so you don't get sick or pass out. Car travel, it is summer vacation. So if you need to travel in a car, it's fine up to 37 weeks. Just be sure you're getting out and stretching every 2 hours, which you will do if you're drinking enough water. Also, you can use your benzoyl peroxide, your salicylic acid, any skincare thing that just doesn't have retinol in it. So no retinol. If you need a retinol alternative, bakuchiol, Bakuchiol, is a good alternative that's in some natural products. And travel by plane, flying is okay for twin moms up to 32 weeks, for singleton moms up to 36 weeks. Just be sure you are wearing a tight compression hose, doing toe lifts in the seat, and drinking lots and lots of water to prevent blood clots in your lungs or your legs. Question here is, what about Nair? Nair is fine. That's fine. Don't put Nair in places that you can't see anymore. Have somebody help you, because you don't want to burn anything that you can't see in some areas. Summer crew, no roller coasters, no water slides. Don't go chasing waterfalls. All right, last thing. You guys are awesome. COVID-19 updates. ACOG moved from supporting either way, whether you get vaccinations, to strongly recommending it after a study of 35,000 pregnant women in the New England Journal of Medicine in 2021. Moderna and Pfizer are fine. Johnson & Johnson is not recommended because of its independent risk of blood clots, which pregnancy also has, and we don't want a synergistic risk of blood clots. So everyone is approved for boosters. If you're 6 months past your Moderna or Pfizer, you can get a booster. In the third trimester is a good time if you're planning to get another one because it will give you enough time to make antibodies for passive immunity for baby during breastfeeding. If you're 2 months past a Johnson and Johnson, you can get a booster, but not of Johnson and Johnson, and therefore mixing and matching is okay. You can get a booster of a different type. There's no optimal time versus flu vaccine, RSV, or Tdap because they are different mechanisms. Next. If you do contract COVID, there are no recommendations for ivermectin, azithromycin, or Plaquenil, so we do not prescribe those. What we do recommend is the vitamin C, vitamin D, zinc that you see in the doses on here, as well as a baby aspirin, the low dose 81 milligram aspirin until 36 weeks. If you contract COVID after 36 weeks, don't start the aspirin because you'll increase your bleeding risk more than decrease your risk for the high blood pressure of pregnancy that we see associated with COVID. At the time of diagnosis, we do begin serial growth ultrasounds after your anatomy ultrasound to just make sure that the vascular formation of the placenta is not being restricted as a result of the COVID infection. So just supportive treatment at home. Remember the medications for cough and sore throat and congestion are all on our website. You only need to go to the hospital if you're having difficulty breathing or you have a fever that's over 101 that you just can't bring down with the normal amount of Tylenol, which is under 4,000 milligrams in a 24-hour period. Also, for those of you who delivered during COVID last time, take a deep breath. It's different now. We're back to our normal amount of visitation. So everyone had about four visitors plus your certified doula. We're not requiring masks in the hospital, in the room, or in labor unless you actively have COVID when you are laboring, which is absolutely miserable. I hope that happens to none of you. If you do have COVID when you're in labor, though, we still do not separate you from your baby. You get an isolette so that baby is not exposed to the respiratory droplets in the room, and we give you an N95 and encourage breastfeeding. All right, so what things are you able to find on our website? Can you find the template for a birth plan? Can you find safe medications in pregnancy? Or can you find what else? Nutrition and stuff like that. Or are you a great test taker and you know that the answer is all of the above? What to expect at each visit? That was the one I couldn't remember. And the polls are closing in 5, 4, 3, 2, 1. Awesome. All right, you guys have been amazing. Thank you for your questions. But yeah, I still feel pretty good about the information I had because I answered all your questions before you asked them, or I was going to later on in the thing. Except for rucking. No one's ever asked me about rucking. You are the first and only person. All right. Please remember that we are social, so follow us on all the things. We are on the Book of Faces. We are on the Gram of Instas. We are on YouTube and X, formerly known as Twitter, sharing all of our mama's birth stories. And thank you all again so much. Whoops, there's another question out here. Oh, okay, awesome. So glad you enjoyed it. I'm glad you were able to make it. And congratulations. I know we're so happy to be over here on the obstetric side. Thank you guys for choosing Full Circle. Enjoy your 4th of July. Do not set off the fireworks yourself personally. Go watch somebody else's thing because I don't want to see you on the news. Where I do want to see you is back in the office real soon. So you all take care. Love you. Bye.